The top stories tonight in Y News. President Rodrigo Duterte to announce new community quarantine status in Metro Manila and 4 neighboring provinces on August 17.
The Labor Department requires wearing face shields in workplaces starting August 15, but it also warns employers who will fail to provide their employees with this protection against coronavirus transmission.
President Rodrigo Duterte may get vaccinated with Sputnik 5 in May 2021, according to Malacanang. British government to create new laws amid the growing threats from hostile states to UK's interest.
Teenagers and young adults who use e-cigarettes are more likely to catch COVID-19, researchers warn.
The UNTV News and Rescue YouTube channel crosses the 1 million subscriber mark. Good evening, Philippines and the world. Today is Thursday, August 13, 2020. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the country and the globe. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news, the prevailing Modified Enhanced Community Quarantine or MECQ over Metro Manila, Bulacan, Rizal, Cavite, and Laguna will expire on August 18. And one day before that, expect another public announcement from the President. Meanwhile, the Palace Cabinet members have an additional job to do. Our Malacanang correspondent, Rosalie Coz, has the details why.
The chief executive is set to announce the new quarantine classifications in NCR and its 4 neighbors one day before the MECQ expires, according to presidential spokesperson Harry Roque. The target launching of additional 250 beds for COVID-19 patients in East Avenue Medical Center on Monday is expected to factor in the decision on Metro Manila's new quarantine classification. Meanwhile, the President's cabinet members and members of the Interagency Task Force Against COVID-19 have been assigned to monitor and support the local government unit's response to the pandemic in areas with a high rate of coronavirus transmission. In particular are the 16 cities and 1 municipality in Metro Manila, as well as the provinces of Bulacan, Cavite, Laguna, and Rizal. This is through IATF Resolution Number 62, in which the IATF members must monitor the health system performance, critical care capacity, stringent compliance with surveillance, isolation, and treatment protocols in the said areas. Some of the IATF members are Health Secretary Francisco Duque and Cabinet Secretary Carlo Nograles, who will monitor Quezon City, Information and Communications Technology Gregorio Honasan, and Anti-Red Tape Authority Director General Jeremiah Belhica assigned in City of Manila, while Education Secretary Leonor Briones and Tourism Secretary Bernadette Puyat will monitor and support Pasig City. National Security Advisor Secretary Hermogenes Esperon Jr. in Makati City, NEDA Acting Secretary Carl Chua in San Juan City, DOTR Secretary Arthur Tugade in Muntinlupa City, while Presidential Peace Advisor Secretary Carlito Galvez Jr. in Parañaque City, DPWH Secretary Mark Villar in Las Piñas City, Presidential Spokesman Harry Roque in Pasay City, Agriculture Secretary William Dar in Caloocan, while in Malabon City are Labor Secretary Bello and CHED Chairman De Vera, while DBM Secretary Wendell Avisado in Navotas and DOST Secretary Fortunato de la Peña in Valenzuela City. Justice Secretary Menardo Guevara will monitor and support Bulacan. Defense Secretary Delfin Lorenzana is assigned in Cavite, while PCOO Secretary Martin Andanar in Laguna and Energy Secretary Alfonso Cusi in Rizal Province. According to the Duterte administration, this is part of the efforts to intensify the partnership between the national and local governments on the country's battle against COVID-19.
So hindi po yan mensahe na may problema mga LGUs. Ito po ay mensahe na kung ano pa ang kinakailangan ng mga lokal na pamahalaan, narito po ang national government, narito po ang national IETF para tumulong.
Yan lang po ay para ma-harmonize yung ginagawa nating policy doon sa taas at saka po yung mga operational framework natin na ini-implement po doon sa baba.
Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Labor Department warns that employers who will fail to provide face shields to their workers shall face liabilities. Joanano tells us why.
The Department of Labor and Employment has ordered the mandatory wearing of face shield in workplaces beginning on August 15. According to Labor Secretary Silvestre Bello III, the employer has the obligation to provide face shields to their employees who are physically reporting to their offices or factories.
Itong face shield is intended to prevent the transmission of the virus inside the workplaces. Kasi may findings ang Department of Health at saka yung mga medical experts na yung contamination o yung transmission hindi lang through the nose or the mouth. Kasama yun ng tenga at saka mata. Kaya para check natin na walang transmission, walang hawaan, bigyan na natin ang mga workers ng protective face shield.
The Secretary adds that non-compliant employers will face administrative liability with corresponding penalties. The Employers Confederation of the Philippines or ECOP is in favor of the new policy. The group expresses its commitment to comply with the mandatory wearing of face shield in workplaces.
Okay, siguro yun kasi mura lang naman yun sa reusable eh. So I think we'll just encourage our to comply. And okay lang siguro for the protection then. We'll encourage people to follow it.
Employees are not allowed to take their meals at the same time. They are also prohibited to smoke in a common area based on the new guidelines released by the Interagency Task Force. The Department of Transportation has earlier announced that mandatory wearing of face shield on public transportation is also effective on August 15. This will be enforced in areas under general community quarantine and modified general community quarantine. Meanwhile, the Department of Trade and Industry assures an adequate supply of face shields in the country so the public do not need to hoard. Based on the standard retail price the DOH released yesterday, the price of face shields ranges between 26 to 50 pesos for every piece.
Kasi marami rin tayong local manufacturers nito, yung mga nag-repurpose from other products before na minamanufacture. Nag-start na gumawa ng face mask, PPEs, at saka face shield. So marami tayong supply, hindi tayo maubusan.
Joanano, UNTV News and Rescue. We serve the people, we give glory to God.
Health authorities warn that the Chinese capsule recently approved and registered in the Philippines must not be used for the same purpose as it is used in China and in other countries. Our health correspondent Aiko Miguel explains why.
Although it is a cure and treatment for moderate cases of COVID-19 in China and in other countries, Lian Joaquin Weng is not registered in the Philippines for the same use. Food and Drug Administration Director General Eric Domingo confirmed that it was on Friday when the traditional Chinese herbal capsule Lian Joaquin Weng was approved and registered in the Philippines. The official said that here in the country, it is used to address symptoms of other illnesses.
Dito sa Pilipinas, approved natin siya as traditional used herbal product that helps remove the heat, toxin, invasion of the lungs, including symptoms such as fever, aversion to cold, muscle soreness, stuffy, and runny nose. Kasi yung mga traditional medicine, usually ang tinitreat niyan yung symptoms at saka ina-alleviate yung symptoms at hindi siya talaga directed to one particular illness.
Yesterday, the Chinese embassy in the Philippines announced through an advisory that the herbal medicine is used to treat moderate and mild cases of COVID-19 in China. The capsule is developed by renowned traditional Chinese medicine manufacturers Shijiwa Zhuang Yiling Pharmaceutical Company. According to FDA Director General Domingo, if the government decides to use it for COVID-19 cases, it still needs to undergo clinical trial like any other drugs being evaluated and studied by different countries.
Ang sinasabi ng Chinese embassy sa China,
Sa China kasi kasama yan ang approval niyan, pati sa SARS, pati sa COVID-19, no? Pero dito sa atin, ang traditional medicine, hindi natin siya ina-approve for particular illnesses. Pwede siyang bigyan yan, no? Pero hindi siya pwedeng i-label sa atin, for example, as treatment for COVID-19. Hindi siya pwedeng i-ibenta as that dito sa Pilipinas.
The validity of the Certificate of Product Registration of Lian Joaquin Wen is only until 2021. Director General Domingo explains it is a prescription drug and cannot be bought over the counter. The DOH will set the capsule's price in the market. There are pictures and videos gathered by UNTV news team on Lian Joaquin Wen, but the FDA will issue its official picture and packaging with translation, so Filipinos can understand it once it will be for sale. The FDA warns the public Lian Joaquin Wen is not sold online. It will be available only from licensed pharmacies, so people should not patronize it when offered online. Aiko Miguel, UNTV News and Rescue. We serve the people. We give glory to God.
President Rodrigo Duterte has said he will be the first person to be administered with a Russian-developed COVID-19 vaccine, but that may happen next year. Rosalie Cos explains why.
President Rodrigo Duterte may get vaccinated with Russian COVID-19 vaccine Sputnik V in May next year, according to his spokesperson Harry Roque. Based on the timeline the palace official presented in September 2020, the vaccine expert panel is expected to review the results of the clinical trial Phase 1 and Phase 2 of the vaccine developed in Moscow. In October 2020 until March 2021, simultaneous Phase 3 clinical trials will be conducted in both the Philippines and Russia. The intercontinental country will finance the clinical trials of the vaccine in the Philippines. The registration and approval of the vaccine by the Food and Drug Administration are targeted to happen in April next year. But according to the palace, a vaccine against coronavirus may be available earlier than next year, since there are other vaccines being developed by other organizations which are already in more advanced stages in their clinical trials.
The May 1 is when the PSG may allow him, pag natapos na po lahat ng mga test na kinakailangan gawin dito sa Gamaleya vaccine. Although ang sinasabi ko nga, baka mayroon pang ibang mauna kasi marami na pong nasa third phase of clinical trials at matagal na po silang nasa third phase.
Meanwhile, around 1,000 Filipinos will join the clinical trials of Sputnik V. According to Dr. Jaime Montoya, Executive Director of the Department of Science and Technology, Philippine Council for Health Research and Development, the Philippines will join the clinical trials for Sputnik V in September, when a formal deal or contract is signed with the vaccine manufacturers. Dr. Montoya made a confirmation after meeting with the manufacturers and scientists who developed the vaccine. Based on Dr. Montoya's assessment, if there are no problems or issues in the trials, especially on the efficacy of the Russian vaccine, in April 2021, it will be ready for mass rollout in the Philippines. Within 4 months, the FDA will give the green light when to start the clinical trials. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
Calapan City in Oriental Mindoro Province undergoes a 14-day modified enhanced community quarantine. This was after the Regional Interagency Task Force Against COVID-19 approved the city's request for an MECQ. Residents must stay at home and only the persons that fall under the category stated in the IATF Omnibus Guidelines are allowed outdoors.
Tracing, testing, isolating, and treating. At yan po ang ginagawa natin. Kaya tayo humingi ng 2 linggo lang naman na paghihigpit.
Markets and businesses in the energy and telecommunications sector may remain open, but with limited operations. Government offices will continue to serve residents through their skeleton workforce. A number coding scheme will take effect among tricycles within the city, returning locally stranded individuals and authorized persons outside of residence or APOR coming from MECQ areas like Metro Manila, Cavite, Rizal, and Laguna will not be allowed entry to Calapan. While LSIs and APORs coming from general community quarantine areas are advised not to travel without securing a confirmation form.
Meanwhile, the country's Department of Health says that 4,002 new cases were reported today based on tests done by 93 out of 100 laboratories. The National Capital Region reported the most additional cases with more than 2,400. It is followed by Laguna with more than 300 new patients and Cebu, which reported 212 additional positive cases. Now, the country's cumulative confirmed cases of coronavirus infection surpass 147,000. More than 74,000 cases remain active. Of those active cases, 91.2% are in mild condition. As of yesterday, more than 1.7 billion individuals in the country have been tested. We have lost 23 more patients. But through our fervent prayers, medical interventions, and sacrifices of our medical frontliners, 1,403 more people have won their battle against the invisible enemy. That brings the total recoveries nationwide to 70,387. Thanks be to God.
Let's take a closer look at the updated count of coronavirus cases around the world. The COVID-19 pandemic has now reached a total of over 20.6 million confirmed cases in 188 countries, regions, and sovereignty. That's after countries reported more than 214,000 new cases in the last 24 hours. The Americas account for more than half of the world's total case load, while Europe continues to struggle with more than 3.6 million cumulative confirmed cases. Global death toll passes 749,000 after close to 5,000 new death cases have been reported since yesterday, while more than 12.8 million patients across the globe have recovered from the new coronavirus infection. Thanks be to God. More than 1,000 OFWs from Qatar and their families will soon be together. Also, scores of our nationals in Lebanon will be flying back home. Here's why from Ray Pelayo.
The remains of 4 of our nationals who died in a massive explosion in Beirut, Lebanon last week are set to be flown back to the Philippines. According to Labor Secretary Silvestre Bello III, the repatriation will also include 47 other Filipinos who suffered injuries caused by the blast and other Filipinos who are willing to come back to the Philippines. 13 Filipino seafarers are also scheduled for repatriation on August 20. Secretary Bello also reveals 2 Filipinos remains missing. Meanwhile, 354 overseas Filipino workers from Qatar arrived in Manila this morning. This is part of the 3 chartered flights this month, repatriating over 1,000 OFWs from the peninsular Arab country. They had lost their jobs to the coronavirus pandemic. Secretary Bello said around 80,000 more OFWs are expected to be flown back to the Philippines. President Duterte has allotted 5 billion pesos for the government's repatriation efforts of our nationals impacted by the COVID-19 crisis.
Hindi naman kami humingi eh. Siguro napansin niya maraming gusto magbawi kaya kusa na niyang binigyan kami ng 5 billion para sa repatriation ng mga OFWs.
The official notes the government has provided financial assistance to around 280,000 OFWs. Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
Labor groups and banning agencies are calling on the government to add more flights and open ports to fast-track the process of crew change in ships. Vincent Arboleda will tell us why live. Yes, Vincent?
Partly, the Trade Union Congress of the Philippines, or TUCP, says that the country's seafaring industry has been implementing only 25% of crew change since March 2020. TUCP notes this limitation has resulted in around 180,000 seafarers being stranded in different places abroad due to COVID-19 pandemic. Those stranded on their ships are even forced to sign an extension of contract, while the seafaring industry is also affected by the COVID-19 pandemic. The TUCP and manning agencies estimate that for the next 6 months, some 180,000 Filipino seafarers are expected to return to the country, with another 180,000 to replace them. Hence, TUCP and the Associated Philippine Seafarers Union and manning agencies are calling on the government to add more flights to cater to inbound and outbound passengers. With the current 3,000 individuals catered daily in the Ninoy Aquino International Airport or NAIA, 1,500 in Clark, and 1,500 in Cebu International Airport, several groups says there is a need to add more flights to ensure that seafarers could disembark and embark on time. The government must also find a way to beef up our COVID-19 testing capacity, as it is also one of the problems of seafarers. The government must also open the ports of Batangas, Bataan, and Subic to decongest the Manila Harbor from ships trying to disembark and embark their crews. Manning agencies say this may worsen now that we are experiencing the monsoon season. Here's what Roy Alampay from the Joint Manning Group said.
Na yung ating mga lancha na supposed to be na dapat maghatid sa ating mga seafarers to and from those ships would take 2 to 3 hours to reach those ships. At yan ay ini-expect na mas sasama pagka tayo ay nakaka-experience ng bagyo or monsoon.
In response to the concerns of the seafarers, the Philippine Overseas Employment Administration or POEA Administrator Bernard Olalla said that the Interagency Task Force has issued an order to different agencies to implement the Green Lane program for seafarers. Through the Green Lane program, crew change, embarkation, and disembarkation of seafarers at all ports are prioritized, meaning not only on one port. The POEA now has an online system to fast-track the disembarkation and embarkation of shipping crews. As for adding more flight schedules and opening ports, Olalla says the government still needs to balance it with the current COVID-19 testing capacity and quarantine facilities.
Hindi lahat kasi ng ports na yan, meron tayong in place na COVID testing at quarantine facility. So pag inalaw mo naman doon, saan natin ilalagay yung seafarers? Yan ang limitation.
Arlene?
Vincent, has the group mentioned how many flights must be added to accommodate the number of seafarers going back to the country in the coming months?
Harleen, the manning agencies believe that the government needs to triple the effort and capacity of airports to address the needs of seafarers and to avoid them being stranded in different areas around the globe. Harleen?
Vincent, we have thousands and thousands of seafarers. How many do we have based on data?
According to the TUCP, the Philippines is currently the #1 source of seafarers, as Filipino seafarers accounts for more than 460,000 or 25% of the total number of seafarers worldwide. Back to you, Harleen.
Thank you so much, Vincent, for that report.
Meanwhile, Cebu City has been designated as a regional site for the next bar examination. According to a notice from the Supreme Court en banc issued today, the proposal to have a regional site for the next bar examinations was received favorably by the law school deans, who have expressed their full support. In a February 2020 survey conducted by the Philippine Association of Law Schools, 89% of the respondents were in favor of a regional site for the next bar examinations, preferably Cebu City. For the Supreme Court, regionalization is crucial now more than ever. What with the anti-coronavirus restrictions that have limited movement between provinces. The bar exams in Manila shall be held at the University of Santo Tomas, while the final venue in Cebu City will be announced at a later date. Law graduates coming from Visayas and Mindanao have the option to take the test either in Manila or in Cebu City. Expect the bar application fees to increase to cover the cost of a regional examination site.
Amid the controversies hounding the Philippine Health Insurance Corporation or PhilHealth, a senator suggests placing a finance expert at the helm of the embattled agency. For Senate Majority Leader Miguel Zubiri, the top choice would be Acting National Economic and Development Authority or NEDA Secretary Carl Kendrick Chua. Zubiri explains a numbers expert with untainted credibility like Chua should head the agency who can identify discrepancies in the budget.
He's my choice. Pinili ko si Carl because I feel that, alam mo, dati siyang DOF Undersecretary. He's now Secretary of NEDA or Acting Secretary of NEDA. I've never heard of any complaint when it comes to his credibility or his work ethic. Napakagaling ng work ethic niya. At numbers guy yan. Talagang nakikita niya yung pinakamaliit na pondo na ilalagay sa iba't ibang mga sektor ng ating budget. So, yan ang kailangan natin.
Secretary Chua has yet to comment on the matter. Senator Zubiri admits, however, that replacing the head of PhilHealth alone will not solve the alleged corruption in the agency. Thus, he recommends revamping all the key positions in the State Insurance Corporation. Senator Richard Gordon shares the same sentiment. He says there is a need to overhaul the PhilHealth system or, at the very least, reshuffle and remove all the officials involved if found guilty. For Senate Minority Leader Franklin Drilon, every official tagged in the alleged corruption and anomalies inside the agency should take a leave of absence while investigations are ongoing.
At this point, all those officials named should take a leave in order to prevent them from having access to the documents.
PhilHealth President and CEO Ricardo Morales is set to take a medical leave starting next week as advised by his doctor. Based on his medical certificate sent to the Senate Committee of the Whole last week, Morales' doctor had advised him to take a leave of absence to complete his chemotherapy for his lymphoma. For Presidential Anti-Corruption Commission or PACC Commissioner Greco Belhica, it only needs at least 6 months to clean up the mess in PhilHealth. According to Belhica, all that is needed is to change PhilHealth's information technology or IT system. Also to remove all the officials and employees who are involved in the massive corruption and fraudulent schemes within the agency. The official also notes many IT solutions companies have been offering their services to PhilHealth for free.
Yung IT system, so merong validation mechanism. When you put that, wala namang papasok ng mga fraudulent claims kasi it will go through validation.
The PACC has set to meet with a task force formed by the Executive Department to turn over its investigation report and recommendations for the filing of cases against the officials involved in the probe. Do you have grievances on the government's social amelioration program? Bringing them to the government's table is now easy through the DSWD's Usap Tayo website. The public can register their grievances online and expect timely and appropriate responses from the Department of Social Welfare and Development. For more information about Usap Tayo, the public may visit DSWD field offices or send an email to sapgrievances@dswd.gov.ph or usaptayo@dswd.gov.ph. You may also provide feedback through DSWD's hotlines 0947-482-2864, 0916-247-1194, and 0932-933-3251. Or visit the DSWD's Facebook and Twitter accounts at DSWD Serves. Now, here's a glimpse of what's the weather like in parts of the country. Tropical Depression Hener has weakened into a low-pressure area. State Weather Bureau Pagasa says as of 4 p.m. today, the center of the LPA was spotted at 830 kilometers northeast of Basco, Batanes. Meanwhile, the Intertropical Convergence Zone or ITCZ is affecting southern Luzon, Visayas, and Mindanao. Cloudy skies with scattered rain showers and thunderstorms will be felt over Visayas. Visayas, Bicol Region, Mimaropa, Caraga, Northern Mindanao, and Zamboanga Peninsula. Meanwhile, the ITCZ or localized thunderstorms will cause partly cloudy to cloudy skies with isolated rain showers over Metro Manila and the rest of the country. No tropical cyclone advisory is issued.
The Anak Pawis militant group believes that the safe security forces are behind the killing of NDFP consultant Randall Echanis based on the victim's political affiliation and background. Our police correspondent, Leah Ilagan, will tell us why.
Militant group Anak Pawis denies pointing to the police as the perpetrator of the killing of National Democratic Front of the Philippines or NDFP consultant Randall Randy Echanis. Instead, former Anak Pawis representative Ariel Casilo says they believe the crime was executed by the safe security forces.
Wala kaming conclusive statement na sinasabi Leia na we jump into conclusion that the suspect is police or military. Wala kaming ganon. Ang sinasabi namin, we highly suspect that this is a handiwork or perpetrated by state security forces based on the political affiliation and political background of Karandi Echanis.
He says that Karandi had been tagged as a terrorist since November 2017 when the peace talks between the communists and the government collapsed.
Karandi was one of the personalities consistently tagged as a communist terrorist personality. So he was consistently red tagged for the last 2 years.
Because of this, the Philippine National Police appeals to militant groups to avoid speculating on the suspect in the killing of Echanis.
It will not do justice sa pamilya at sa mga biktima kung ang pairalin ay guesswork at spekulasyon.
Banak adds the Quezon City Police District is conducting a thorough investigation to identify the suspect.
Ang tinitiyak natin sa ngayon ay may masusing investigasyon na isinasagawa ang Philippine National Police. At tinitiyak natin din na hinahabol natin ang mga suspects at upang mapanagot sila sa krimen na kanilang ginawa.
Meanwhile, Anak Pawis says they will file charges against the policemen who allegedly held Karandi's remains hostage.
The lawyers is firmly considering filing administrative criminal case against the Loma police element and those who name drop na nag-order daw na kuhanin or i-take custody yung bangkay.
But the PNP explains there were no lapses on their part. They only exercised the proper procedure in identifying a dead person bearing 2 different names. The PNP also asked for understanding that the process took almost 2 days to finally confirm that Manuel Santiago and Randall Echanis are one and the same person.
Sa ngayon, wala naman tayo nakikita na lapses doon sa pangyayari. Yun ay bahagi lamang ng procedure na ginampanan ng ating investigation body, ang pagsasagawa ng proper identification ng isang tao, lalo't ito ay isang dead body.
The DOJ Special Investigation Team will begin to investigate the slaying of Echanis. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
Vice President Leni Robredo urges the Department of Education to realign its funds for the rehabilitation of school buildings to distance learning needs. Dante Amento tells us why.
In her letter to the Education Department, Vice President Leni Robredo relayed some concerns of teachers over distance learning this upcoming school reopening. For one is internet connectivity. Data show that 61% of the 14 million households in the country have no internet connection. Of the 47,000 public schools in the country, 74% or 34,700 do not have the infrastructure to engage in online learning. Only 7 million of the 27 million students have subscribed to DepEd Commons, where self-learning modules can be downloaded from. Some teachers who lack gadgets have yet to receive the modules. Another question is who will shoulder the reproduction of learning modules. Educators also worry about their health amid this COVID-19 pandemic. With this, VP Robredo urged DepEd to use its 29.5 billion peso budget for the rehabilitation of schools for procurement of gadgets, equipment, and health needs of teachers. Given the situation, face-to-face classes are prohibited and school buildings will be left without students to occupy them. 700 million pesos worth of fund for trainings can be utilized as supplemental budget, VP Robredo suggested. But DepEd Secretary Leonor Briones says they cannot use the fund that is allocated for a specific purpose or project without consulting the Department of Budget and Management.
We cannot make very significant policy realignments sa budget without consulting the Department of the Budget and Management.
DepEd adds it has already downloaded a 9 billion peso budget to their regional and division offices for the reproduction of modules. VP Robredo also proposes to conduct mass testing for teachers and results should be out before the classes begin. VP Robredo also seeks the assurance that teachers have materials equipped with PPEs and provided with hazard pay regularly and on time. Secretary Briones, for her part, allays fears among teachers of contracting the virus.
Ulitin ko, walang face-to-face hanggat walang vaccine. Yon ang sinasabi ni President. Therefore, the teachers will not be exposed from teaching as a result of teaching. If they will be exposed, there might be other causes.
Dantiamento, UNTV, News and Rescue. We serve the people. We give glory to God.
And for the news abroad, here's Jovic Vermas live from London, United Kingdom. Good evening, Jovic. What have you got for us tonight?
William, the UK government is making new laws amidst the growing threat of hostile states to the country's interest. Meanwhile, a close advisor to Venezuelan President Nicolas Maduro adds to government leaders who have been diagnosed with COVID-19. And later, I will also tell you why researchers warn that teens and young adults using e-cigarettes are more likely to catch COVID-19.
Go ahead, Jovic. Please tell us why.
The UK's Common Defence Committee is currently reviewing its foreign and security policy, looking at the threats posed to UK by hostile states. This comes after members of the parliament warned that China and Russia are using the pandemic to their global advantage and must be stopped in their attempts to disrupt UK's national and international interest. UK Deputy National Security Advisor Alex Ellis told the committee that coronavirus was expected to cause intensified geopolitical competition. While the UK, Russia, and China lead global efforts to produce a vaccine, Russia on Tuesday said it had given regulatory approval to one after less than 2 months of human trials. Recently, the UK accused Russia of stealing British scientists' vaccine research, which Moscow denied. The committee also heard that both Russia and China were employing disruption as a major tool. Meanwhile, Home Secretary Priti Patel introduced new powers for police and are training them to exercise their position to stop, question, and detain individuals traveling through UK ports who they suspect of espionage. Downing Street promised an extensive integrated review since the Cold War of foreign, defense, security, and international development policy. Also in the UK, Figures from the National Health Service or NHS reports that the number of patients admitted for routine treatment in hospitals in England was down 67% in June compared with the same time last year. NHS data shows that the number of people going to accident and emergency units in England in July was also down on last year by 30%. The coronavirus pandemic has caused disruption in many areas of the health service, but Britons are urged to seek help from the NHS when they need it. A close advisor to Venezuelan President Nicolas Maduro has said he has tested positive for COVID-19. Jorge Rodriguez, Venezuela's communications minister, said he feels well despite being diagnosed with the virus, adding that he would go into quarantine. Rodriguez is the latest high-ranking member of the President Maduro's government to contract the virus. As of today, Venezuela has more than 29,000 confirmed COVID-19 cases and 247 deaths since the start of the pandemic, but with over 21,000 recoveries. Let's now take a closer look at the updated count of coronavirus cases in countries worst hit by the pandemic. The total case count in the USA will almost pass 5.1 million as of today. Still, it has the most caseload, with California and Florida, the states worst affected by the pandemic in America. Brazil's confirmed COVID-19 cases crosses 3.1 million, but with more than 2.5 million recoveries. Now India registers more than 47,000 deaths, overtaking UK to become the fourth worst affected globally for fatalities. However, some experts believe the low fatality rate doesn't tell the actual story. Experts point to sizable undercounting because India is not adding suspected cases in the final death count, and some Indian states are attributing COVID-19 deaths to the underlying conditions or comorbidities of the patients. Meanwhile, while the Philippines, with today's more than 147,000 cumulative cases, remains at the 22nd place among countries impacted by the pandemic. Elsewhere in Spain, the region of Galicia has effectively banned smoking in public places. This is the latest move to address concerns over the risk of COVID-19 transmission. A blanket ban on smoking in the street and in public places, such as restaurants and bars, if social distancing is not possible, takes effect. The northwestern region is the first to introduce such a measure, although others are considering following suit. Spain now has over 329,000 confirmed coronavirus cases as of today. Global explosive violence has sharply declined during the COVID-19 pandemic. New data suggests. Data gathered by Action on Armed Violence suggests there was a 58% decrease globally in civilian victims from explosive violence between April and July 2020, compared to the same 4 months last year. Action on Armed Violence, or AOAV, is a London-based research charity that tracks English-language media reporting of explosive violence. Measures to respond to the deadly pandemic appear to stay the hands of militaries and of terror groups, leading to the lower number of 1,001 incidents. This comprises a drop of 58% in civilian harm compared to a year before. Airstrikes seem to have been largely suspended during the lockdown. Countries that have seen a notable drop-off in violence are Syria, Afghanistan, Yemen, Somalia, and Pakistan. Although the same data shows Libya was one of the few countries that saw a rise in civilian harm. Meanwhile, environmentalists warn of surge in medical waste and marine pollution in Australia. One of our correspondents in Australia, Marvi Delphine, will tell us why live. Marvi, why do these environment welfare advocates say there's been a surge in medical waste?
Gov't, due to the coronavirus pandemic, with hundreds of thousands of masks now being manufactured every day, conservation experts have flagged environmental and biosecurity concerns about where these masks will inevitably end up. On July 22, when face masks were announced to be mandatory in COVID-19 hotspot postcodes in the state of Victoria, sales skyrocketed by 480% in just 24 hours. According to the Victorian government website, 23 million single-use masks have been ordered by the state, and more than 1.5 million have already been distributed to hospitals, schools, and public housing. When suddenly there is a population of 20 million Australians in the eastern states wearing 1 to 2 masks per day, the amount of waste generated is going to be substantial. It may not be natural to consider the environmental impacts of face masks and other personal protective equipment or PPE in the midst of the pandemic, but experts say that attention must be paid to an environmental problem that will far exceed that of the virus and affect generations to come. While these face masks are indispensable to protect the health of Australians, they are often disposable and non-recyclable. Australia Marine Conservation Society plastic spokesperson Shane Coco said that the nationwide uptake of PPE has been critical for our health and safety, but it is bad news for ocean wildlife. With little information on how to recycle or dispose of these new plastic products, these plastics are likely to be ending up in our oceans alongside the tide of other single-use plastics already threatening animal lives. Given that surgical masks are supposed to be worn for no longer than 1 day, their disposal, along with that of empty hand sanitizer bottles, soiled tissue papers, and PPE, is leading to a massive trail of clinical waste in the environment. Jovic?
Well, Marvi, based on these observations, what do these environmentalists propose to the Australian government to respond to this concern?
Jovic, environmentalists suggest that the government to create general awareness of these problems and biohazard protocols. They also suggest prompting people to embrace reusable masks over single-use ones and swap use of latex gloves with manual hand hygiene practices, like frequent hand washing. Jovic?
Also, Marvi, could you give us an update on the latest count of COVID-19 cases there? We know that Victoria is really hard hit by this pandemic. Are there stricter measures for residents and travelers alike?
Jovic, today Victoria has recorded 278 new cases of COVID-19 and sadly 8 deaths, down from the record-breaking daily toll of 725 cases from last week. For people living in metropolitan Melbourne, Stage 4 restrictions currently apply. A curfew is in place between the hours of 8 p.m. until 5 a.m. This means residents must be at their homes during these hours. The only reasons to leave home between 8 p.m. and 5 a.m. will be work, medical care, and caregiving. As for traveling, residents can only travel up to 5 kilometers from their homes. Also, only one person per household can leave home to get necessary goods and services. So far, these are the updates implemented to slow the spread of coronavirus by reducing the number of people leaving their homes and moving around Victoria. Jovic?
Thank you, Marvi. You stay safe in Australia. Researchers at the Stanford University found that teenagers and young adults who use e-cigarettes or vape are at a greater risk of COVID-19 than non-users. Using U.S. population-based data collected in May via online surveys, vapers or cigarette users in this age group category were 5 to 7 times more likely to be infected than those who did not use e-cigarettes. The study's senior author and a professor of pediatrics Dr. Bonnie Halpern-Felcher emphasized that when young adults use e-cigarettes, they are likely at immediate risk of COVID-19 because they are damaging their lungs. The study also suggests that it is not just a small increase in risk, but a big one, said Dr. Shivani Mathur-Gaia, lead author of the study. Dr. Gaia adds, young people may believe their age protects them from contracting the virus or they will not experience symptoms of COVID-19. But data show this isn't true among those who vape. The surveys were completed by 4,351 participants residing in the United States, ages 13 to 24, and was evenly divided between those who had used e-cigarettes and those who had never smoked nicotine products. Young people who vaped or used cigarettes in the previous 30 days were almost 5 times as likely to experience COVID-19 symptoms, such as coughing, fever, tiredness, and difficulty breathing, as those who never smoked or vaped. Participants were also asked if they had experienced COVID-19 symptoms, had been tested for COVID-19, or received a positive diagnosis of COVID-19 after being tested. Researchers hope this study will prompt relevant authorities to impose tighter regulations governing how vaping products are sold to young people. And those are the reasons behind the news here in the United Kingdom and in other parts of the globe. Back to you, William.
Thank you, Jovic. Stay safe there in London.
UNTV News and Rescue reaches another milestone, and we always say, to God be the glory.
Our kasangbahay, we are thankful to say that the UNTV News and Rescue YouTube channel today reached the 1 million subscriber mark. UNTV, formerly known by two brands as UNTV News and Rescue and UNTV Public Service, is devoted to sensible broadcasting, highlighting alternative and intelligent programs. Programs at UNTV are designed to reflect positive spirit and values that adhere to safeguarding media freedom and responsibility to delivering free, responsible, and responsive network. Although the coronavirus pandemic has affected some of UNTV's operations, the company continues to pursue its goal to reach out and extend a helping hand to people through its programs. In the middle of the crisis, new projects were born to better serve the public, like Serbisyong Bayanihan, which aims not only to assist our fellow men adversely affected by the coronavirus pandemic, but also gives opportunity to those who want to give a helping hand.
Sa lahat po ng gustong yung tao na tumutulong po sa amin ngayon, maraming salamat po kahit hindi ko po kayo kakilala. Maraming salamat po.
Other UNTV News and Rescue programs, which are public service centered, are Serbisyong Kasangbahay, Doctors on TV, Lifesaver, and a lot more. Its news arm also continues to give the public the latest, biggest, and most relevant updates not only in the Philippines but all around the world. And upon reaching this new milestone, we will always say, to God be the glory. Mirasol Abugadi, UNTV, News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news, August 13, 2020. I am Herlene Delgado. We serve the people. We give glory to God.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And I am William Theo. Because we need to know, we will always ask why. Have a great evening.